You might already know that dyslexia is a language-based learning disability. Among other things, dyslexia affects a child's ability to read and to spell. But did you know that many students with dyslexia may have additional language concerns? Some of these language challenges are evident very early on in a child's life, even before he heads off to school. Our guest today will help us to better understand language development and language disorders. Welcome, Jacey. Tell us a little bit about who you are and what you do.
Hi, Erin. Thank you. Hello, everybody. My name is Jacey Dillon. I am a speech language pathologist with Rise Up Therapies in Franklin, Tennessee. We also have a sister company in Spring Hill called Arise Therapies, and we are a private pediatric clinic with speech therapy, occupational therapy, and feeding therapy. In terms of the speech therapy side of things, we treat a lot of different areas, including early intervention, birth to 3 age range, elementary school, all the way up into adolescence, and then some adult patients as well. Like I said, we're primarily pediatric, so we do treat language disorders in children and some articulation concerns as well, sometimes some speeding difficulties with those kiddos as well. So wide variety of things, but lots of overlap, of course, with kiddos who struggle with dyslexia.
Jacey, let's talk for a moment to the parent of young children. Tell us some of the milestones of typical speech development.
Sure. So we do see, like I said, a lot of early intervention children. So looking at that kind of birth to 3 range, what normal speech and language development looks like. Really, we expect to see first words by around 1 year. And then by the time we get to 2 years, we would expect kids to be combining words so that they can communicate their wants and needs a little bit more, expanding their vocabulary. As they continue to grow and develop, they add more grammatical things in, like pronouns or connecting words or verb tenses, that kind of thing. And once we get into more elementary age range, a lot of those grammatical structures should be present and kind of mastered as they are getting a little bit older and they're expressing more complete thoughts.
I mentioned in the introduction that students with dyslexia sometimes have additional language concerns. Describe for us some of those language concerns that you see in students with dyslexia.
Yeah, for sure. So a lot of overlapping areas for sure in dyslexia and language. They're very connected. One thing that we see a lot kind of go hand in hand with kiddos who have dyslexia is difficulty with some higher level vocabulary. A lot of times they need that specific instruction and kind of review of some more complex vocabulary, word meanings, that kind of thing that also help with reading comprehension. That's a big area that we see with dyslexia too, is difficulty with reading comprehension and in general kind of summarizing information, especially that they've read or heard, kind of picking out relevant details, all of that kind of thing. Those kind of language barriers we see a lot with dyslexia.
Now, some of our students also have issues with articulation. Can you explain what articulation is to these parents?
Yeah. So articulation really refers to the speech sounds and the production of speech sounds. So we do see a lot of patients who have difficulty producing certain sounds with the placement of their articulators, their tongue, their lips, jaw, all of those things working together. And then we also see some kids who struggle with more phonological awareness that ties into both dyslexia and speech sound production, just being able to hear speech sounds and kind of discriminate them from each other, and then kind of putting those into the right spots in words. So that's a lot of times where we see that overlap with reading difficulties too. If they're not hearing and being able to discriminate the sounds, then once they see the written version of that, sometimes that really impacts that as well.
So I heard you say they have difficulty hearing and discriminating, but you're not talking about a child who needs a hearing test to actually sense the sounds. You're talking about the ability to discriminate one sound from another or manipulate sounds, right? Not just the ability to hear.
Correct. Yes.
Okay.
Yeah.
Tell us a little bit about some other language disorders. I think the parent term is language disorder, and then you might hear the terms receptive or expressive language disorder. Describe those for us, please.
Yeah, so receptive language disorder refers more to what a child is understanding. So a lot of times we check for things like being able to follow directions or being able to identify vocabulary. If they're presented with a picture of two animals, can they verbally identify which one is which, kind of match that to the word. And then as it relates to more complex language, just being able to hear something or hear a story, more lengthy, complex language, and being able to answer questions about that. That all relates to what they're understanding. And then expressive language is the verbal part of it. So kind of the opposite, what they're able to verbally express. And so we see kids with both deficits in both things. A lot of times what kids are understanding will be a little bit stronger than what they're expressing. That's natural for most kids and even into adulthood. But yeah, looking at both of those aspects, both understanding and then also expression.
Can a child have both dyslexia and one of those language disorders?
Yes, yes. And oftentimes we do see both of those together.
Mm-hmm. Well, tell us, who needs an evaluation by a speech language pathologist, or when should parents start taking action?
Sure. So starting from an early age, definitely if your child has not started to say words yet by 1 or a little later than that, that would definitely be kind of a hint from the very beginning to pursue some evaluation to see if they need a little bit of extra help, kind of those late talkers. And then especially as we get older, if we still notice, that they're not able to express their wants or needs, by 2, if they're not starting to combine words, that would be a little bit of a red flag to go and seek an evaluation. And then as they continue to get older, if they're not using some of those age appropriate grammatical structures, if they're still having difficulty effectively communicating, especially in different contexts, if it's beginning to affect their performance and participation at school or just being able to be understood by other people, then that would indicate that they would most likely need an evaluation from us.
We're talking about a wide range of language skills here, but let's talk about next what it's like when a parent calls and schedules an evaluation. What is it like for that child when they walk into your office for that evaluation? What are some things that happen?
Yeah, for sure. So depending on what the concerns are, most of our evaluations are either an hour long or an hour and a half long. So we are a pediatric clinic, so we try to make it very fun for the kids. We use a lot of games during our assessments to kind of break things up or just give the kids a little motivation, kind of make them feel at ease and make it a fun experience. And usually what we'll start out with is just the therapist having a conversation with the parents about their primary concerns, just getting some of that case history and digging in a little bit more to what areas we might need to look at. And then we will administer some formal standardized testing. Most of our assessments that we give for our pediatric patients are picture-based, so a lot of looking at pictures, nothing too crazy scary most of the time. As we get older, of course, some of the tests get a little bit more complicated, but we definitely, like I said, take breaks, play games in between, make sure that we get what we need, but also make sure that the child has a good time and a good experience and something that they want to come back and learn more.
How does an evaluation by a private clinic like yours compare to an evaluation by a public school?
Sure. So one of the main differences between a school-based evaluation versus a private evaluation is that usually in the schools, the scores that a child would receive on the standardized testing would need to be significantly lower in order to receive services compared to us in a private clinic. Usually we can make a case for treating a wide variety of things, even if they're slight deficits or very specific things that sometimes they may not be able to qualify for services in the school for. So that's one of the main differences. Also, in general, I think from my experience, it's easier in the private clinic setting for our therapists to be more directly involved with the parent and give that kind of home carryover and even explanation from the very beginning after the initial evaluation compared to in the school. I know sometimes that communication is hard to keep up with when you're not seeing the parents face to face every session.
Is it possible for the school speech pathologist to collaborate with a private clinic such as yours? Do you ever do that?
Yes, for sure. We do that all the time. Sometimes we have the schools reach out to us for a patient. Sometimes we reach out to them first. But we do like to collaborate as much as we possibly can, especially when the patient is receiving services in the school system as well, to kind of make sure that we're on the same page, we're consistent in what we're targeting, and that we're overall, providing the best services for that child.
Tell us a little bit about what a speech therapy session is like.
Sure. So like I mentioned before, we like to incorporate a lot of play, especially for our younger pediatric patients. Play in general is a great learning experience for an environment for our patients. So in terms of a speech and language session, we might target a little bit of some speech sounds, usually maybe with a game, taking turns and also practicing some of our sounds in between turns of a game. Sometimes we have physical paper activities, crafts, things like that can facilitate some functional words to target with whatever speech sounds we're working on. And then in terms of language, also depends on what area we're treating, but again, a lot of play-based therapy, doing some pretend play with some of our younger kids and kind of modeling and targeting some of that early language, combining words, that kind of thing. For some of our older patients, focusing on some specific activities that can target some of those grammatical things, but again, making it very functional and kind of relevant for what they're interested in as well. And a lot of times we'll have, themed activities throughout the clinic too that kids can participate in with another patient together, to kind of include that social aspect and show them that, other kids their age are also here and working on some of the same things.
I love that. These language concerns are very common. We see them a lot in our private dyslexia therapy, in addition to the dyslexia. And so it does really help a child to know that he's not the only one or she's not the only one. I will offer this as a comment as well. We have speech and language concerns, and then we also have reading concerns, such as dyslexia here. And I describe it to parents as a railroad track of language. And if your child has both concerns or disorders with both reading and speech and language, it's really important to have both treated at the same time. We have found, and there's research that says if a child has dyslexia, but also has a language disorder that's untreated, there could be a point at which the dyslexia therapy stalls out, or we aren't able to make as much progress as we would like. And so it's great to have practices that can do both. It's great also to have, different practices that can collaborate together so that the child can receive both of those things and really grow in his language development. Jacey, tell us a little bit more about where parents can find you and your team.
For sure. So you can find us at riseuptherapies.org or arisetherapies.org. We're also on Facebook and Instagram. So you can find us at the same Rise Up Therapies or Arise Therapies on both of those platforms. And yeah, there should be a contact section on the website too. If anybody's in need of an evaluation or anything like that, they can definitely feel free to reach out to us in that way.
Thank you so much. You shared just great information that I know is going to be a benefit to many families. Thank you, Jacey.
Hey, thank you so much.